I hope you're all seeing the wonderful Valkyries of the Warriors Golden State stable. They're here to entertain us this summer. They are the most successful team in league history. Already in their first year, their attendance is way above everybody else, and their valuation has just skyrocketed. And why is that? Because of the LGBTQ community, it turns out. That's what jump-started them. And it's making headlines in our local newspaper, but I didn't get this news from our local newspaper. It came to me by other means. So the Valkyries, they are the famous Norse mythological female titans, 8 of them. Welcome, Sonia. Uh,
And you're a little late. I had trouble getting in, but I'm glad to be here.
okay, glad to have you. And this is the new thing, V's up. So if you see somebody walking around V's up, it's kind of code for the Valkyries fans in the queer community. You heard it here first. Okay, what will be celebrated next year in 2027? It's one word with 7 syllables.
2026.
2026, thank you. You got to watch me. 7 syllables celebrated next year. I won't torture you anymore. It's the semi-quincentennial, our nation's semi-quincentennial, which equals 250. All right, you heard it here first. Event of the week, Mamdani's upset of Cuomo in New York. And make America affordable again. That's what he really concentrated on in his campaign. So cost of living, I think Pepper sent me this, maybe it was Jim. The cost of living in the United States, the darker the color, the worse it is. And you can see up here in New York, it's pretty dark. And so, what is New York City? Just to review, 5 boroughs right here. And what it isn't Long Island. So Long Island is separate, but the history of the early days of during the American Revolution, a key battle was fought here in Brooklyn, and the British invaded and snuck up on them at night from literally behind the lines and attacked them from the rear in Brooklyn, forcing Washington across the East River, and the chase was on. So, Mandani, here, what is the connection of Mandani to these movies? Salam Bombay, Mississippi Masala, the Perez family, the Kama Sutra, monsoon wedding. Anybody want to hazard a guess? Bob.
My guess is that his mother either acted in, produced, or directed them. But I didn't realize it was so many movies.
Yes, his mother. You get a gold star. Here she is. She is Mira Nair, who was born in the Punjab as a Hindu, showed promise in school and was plucked from Indian school to Harvard. She met her second husband, thus the name Mandami, while she was researching Mississippi Masala in Uganda. So her husband is Indo-Ugandan political scientist, Mahmoud Mandami. He is a Muslim. And here he is. This was her second husband. And he is a professor of government at Columbia, focusing on anthropology, colonialism, and post-colonialism. And he was involved in an airlift of students from Uganda during 1963 when Kennedy was president to study here. And he became an activist back then, joining SNCC and going south for that big summer voting registration. And he learned about Marx. So does this ring a bell? Think of Kamala's parents. Her father was a Marxist of economics at Stanford. So he eventually got his PhD at Harvard, went back to Uganda, but Idi Amin prosecuted him, and he fled in 1974. So that's Mandani's background. Pretty amazing. So he had a built-in visual media consultant, his mother. And here he is campaigning with AOC, excuse me. So amazing. There are skeptics, of course, as there always are. But one of his ideas is to attack the food desert. And I don't know how many of you have been to New York City. We have really good friends from grade school, actually, who are there, and we visit them multiple times. And let me tell you, it's hard to get fresh fruit and vegetables at a bodega. You go in and there just isn't any. So if this is what he's attacking, I'm all for it. The idea is to have government stores that would not pay rent or property tax, not be under the need to turn a profit. And maybe now they could be managed with AI. Government programs are famously inefficient, but maybe with AI that doesn't always have to be so. So he's really interesting. Even though it would be a real challenge, because the common conventional wisdom that you need 15,000 customers in your catchment to have a viable market. And in New York, with all the bodega little stores, it's more like it's a very favorable ratio, but favorable for the consumer and handy, but maybe not favorable in terms of efficiency. It's not like New York City would be the only place. There are other places like Kansas and Florida where they haven't thrived, they've struggled, but other places under duress, when they're losing their last grocery store, have set up these state-run food outlets, which is similar. There are a lot of states that control liquor sales. So it's not unheard of to do retail through the government. Mandami, therefore, appeals to old school progressives. I have to give a shout out to our founder, Ramsey. This is what Ramsey has to say, and I'm going to linger a little bit on this just out of homage to the fellow that got a lot of us interested in history. He thinks it's long overdue We should have backed Bernie in 2016 and stuck with it. We see that populism has done, and continues to do quite well. He asks us to go back to 1854 when the Republican Party was born, and they got whipped in the 1856 election. But they did pretty well in 1860, and eventually went up against the Democrat Party, which was the Southern Party, and the Supreme Court, and stuck to their guns literally. And the morass we find ourselves in now, going back and forth over social issues, we got to somehow get out of that and look at true solutions like wealth taxes and health care for all and child care for all and cheap and good food. And so child care for all, well, that's a pipe dream, except in New York, as you'll soon see. And Ramsey thinks that maybe public service after leaving high school would be a good thing. And John F. Kennedy thought that too, as some of us remember. And he's very much thinks tacking to the middle to try to please an imagined constituency is exactly wrong. And in the election, he sees a lot of hope in the fact that the young people went for Mandami and old farts for Cuomo.
John, who was the person to the right on that slide?
The president, this is Ramsey.
Yeah, that's Janet.
And that's Janet.
Okay.
Yeah, thanks for clarifying. I forget some of us aren't as familiar with these profiles as others. Thank you.
Thank you.
So New York successes. One was pre-K, but the other big success is congestion pricing. It was met with skepticism. It'll never work in New York. Americans will never go for it. But guess what? They are, and it's solved the problem. I'm not overstating it. This is a universal blue ribbon. Everybody agrees. And the one rule is the bigger you are, the more you pay. So motorcycles get off cheap. Taxi drivers, they have to pay $1.25 per ride, and Uber has to pay $2.50. So it's working, and you almost wonder whether it would be a good thing for us here in the Bay Area. So pre-K, who did that? Bill de Blasio. And what did he get for pulling off this miracle? Nothing. He got booted out of office because the electorate was all, what have you done for me recently? So in contrast to what we're seeing today, I mean, this very day, it's terrible. And it's reverse Robin Hood. This bill that the Senate is deliberating is scandalous. They're going to take away Medicaid health insurance and pretend that they aren't. But that's what they're doing. And it's going to be from 12 million people. It's awful. And good old Heather Cox Richardson, she's the best curator I've ever found. She is giving you background and up-to-date stuff. And this is in today's letter. She quotes Sheldon White House, and I'm going to read it because I think it's important. This place feels to me today like a crime scene. Give some of that yellow tape and put it around this chamber. This piece of legislation is corrupt. This piece of legislation is crooked. This piece of legislation is a rotten racket. This bill cooked up with back rooms, dropped at midnight, cloaked in fake numbers with huge handouts to big Republican donors. It loots our country for some of the least deserving people you could imagine. When I first got here in this chamber years ago, it filled me with awe and wonderment. Today, I feel disgust. Thank you, Heather Cox Richardson, for passing that on. So is this 2017 all over again? And this is a famous photograph. It made me sick when I saw it. It was Trump gathering the House after they had passed this abominable legislation that was going to get rid of Obamacare. Trump thought his nemesis, Barack Obama, he was finally going to get revenge. This article says, guess what? This is exactly what the GOP is trying to do. They're not calling it repeal Obamacare, but by attacking Medicaid, that's what they're trying to do. And we all know how that ended when McCain famously came out and decided that the Senate was not going to do it. So the Senate is deliberating today. And
it passed it. It's passed, John.
His thumbs down. Yes.
It's passed.
It's what?
It passed. J.D. Vance broke the tie to pass it.
It did?
Yeah, last night.
Huh. I didn't read anything about that in the morning papers, but I
It
hope
was about 3 hours ago.
I hope. Okay. All right. So,
Yeah, it passed a couple of hours ago. It was 50-50. Vance came in. The three senators who voted against it were Tillis, Rand, and Collins.
Oh, Collins did go. Damn.
Well, yeah, but so this is sort of interesting. I looked up when she is for her reelection. Guess when she's up for reelection?
4 more years.
No, she's up for reelection in 2026.
Oh dear.
And guess when Murkowski is up for reelection?
Same year?
No, she's in 28. No. So yeah, I mean, I'm being a conspiracist here. It was all conspired to be this way. She votes against Trump because that gets her reelected in 2026, and Murkowski's out there in 2028, and people will forget all about this.
Oh, the next few slides are out of date. Geez, I just put them up this morning. So this was Tillis. God bless him, joined by Rand Paul for different reasons. Rand Paul is a budget hawk. But there they were. And here's Murkowski. She was surrounded by GOP leaders wherever she went. And so they came up with provisions just for her that applies to the 2 non-contiguous states, because everybody knows that Hawaii and Alaska have a lot in common. And what are they going to get? What is she going to get? Higher Medicare reimbursement, exemption from supplemental nutrition assistance program, and benefits for whaling captains in rural hospitals. So it turns out that her being bought up is what allowed this to go through. I can't believe it. Yeah, Michael.
I think it's called bribery. She was bribed. They gave her all these little perks, the usual pork barrel stuff. I wouldn't be proud if I were her.
Yeah,
she doesn't sound proud when she talks about it. She doesn't want to talk about it.
Yeah, so one theory is she kept asking for more, and they kept giving her more. They kept asking her for, she kept asking for more. They kept giving her more. She kept asking for more. They kept giving her more. So at the end of the day, she couldn't say no.
Oh boy. Well, Sheldon Whitehouse
Had it right.
had it right. So this is Thune. The other people he had to schmooze were these guys and a woman from Wyoming, and they schmoozed them, and with J.D. Vance got them to join, and so I want to talk a little bit about what exactly is in the bill and why America's hospitals don't want their taxes cut. So I want to go a little deep on the gimmick, because you're going to hear a lot about the provider taxes. So these are obscure taxes that hospitals and nursing homes currently pay, but they get it back. And here's how the shell game works. It's a gimmick to fund Medicaid, to fund charity, basically. If they didn't have this, they would have, these small hospitals would have to eat their charity care. But this is the mechanism by which we give hospitals money for charity. It's that simple. And the American Health Association's president is saying if you take away this mechanism, rural hospitals are going to close. So sure, it's a financial shell game with perverse incentive, but it's the only thing that's working to get charity care paid for. So what happens is they pay this tax. Washington matches it, so that amounts to doubling the federal contribution. So because the state pays their share with this provider tax. And then when the money comes back from Washington, they make a profit, and because they count it as a Medicaid expenditure. So it's double matching. That's what the states are doing in this shell game, getting the feds to double match. And Arizona, for instance, does this to the tune of $1 billion a year with this system. So I know it's complicated. I barely understand it myself, but this is from a couple of sources that made it somewhat clear to me when I'm alert early in the morning and thinking super clearly.
John, did you happen to see the New York Times this morning? And the amount of things that are in that bill. The Times has a register of all of the things, and there must be, I think that I counted up, there's 20 pages of 15, so there's over what is that, 300 or 400 items that are on there, line items. Some are positive, some are negative, and anybody to figure that out is, you got to be, then everybody could complain of, and that it's crazy. It's just beyond anything I've ever seen, certainly. And nobody that I can see could ever figure out what it is that are we going to be it's kind of the big bottom line. Is this a good thing or a bad thing? It's
a bad thing.
Yeah, it is. It's just ridiculous.
Well, this is how bad it is. They're going to be talking about the stricter limits on these provider taxes, and they're going to reduce the allowable rate from 6% down to 3.5%. So the state can't make that money to recirculate and have the feds match it. So the only thing the states are going to be able to do, they're going to be forced to cutting Medicaid benefits. Here's an interesting fact. Trump won Medicaid recipients by 2 points in 2024. So do they understand this was what he was going to do? Back in 2020, when McCain was fresh in their minds, Trump lost the Medicaid vote by 19%. So what's going to happen on this seesaw in 2028? I hope that this is the nail in their coffin, but unfortunately, a lot of people are going to suffer and have to be seen to suffer for this to sink in, what they've just done. So last week, and I don't know if they successfully negotiated that in the last 24 hours, but the parliamentarian last Thursday, said that they couldn't futz around with the provider tax. So I'll be really interested to see what the provider tax actually is. And Holly, the Republican from Missouri, and I never let David Kennedy forget it. He was the chief, he was the chair of the history department at Stanford, and he was Josh Hawley's mentor. He said that good, the Senate has the chance to get it, and so we don't defund the rural hospitals. So he must be satisfied somehow, and we'll see if that involves the provider tax, because the parliamentarian said it couldn't. Of course, most Republicans said, well, let's just fire the parliamentarian. But Thune rejected that, at least as of this morning, and he took the bill to the Senate, and they were going to fix the parliamentarian objections there. Were they able to do that this morning?
They did.
Okay.
Yeah, no, and what you'll see on that tabulation of all of the things that were there, they just strike it out and said, okay, well, it's not relevant. And so they basically put it off till some other day.
Well, we'll see. There are a couple. I mean, it does have to go back to the House, and they have to approve it. So it's not a totally done deal, but it's more done than I thought it was 20 minutes ago.
Hey, John, before we leave Medicaid, I just want to say something that I heard on CNN and MSNBC. So the point here being is that this stuff about Medicaid, it doesn't kick in until after November 26. In other words, after the next midterm election.
Oh, isn't that convenient?
Well, yes, but Obamacare didn't kick in until after a midterm election. But anxiety over it hurt the Democrats in that midterm. So enough talk about this, and the Democrats are going to keep the talk up about the cuts here.
Yeah, but the point being there is it doesn't start affecting people until after the election in 2026. That's the point.
That's correct.
I mean, they can do all the talking they want to, but when it starts hitting people directly, then it becomes a different story.
My point is the talk about Obamacare was enough to really hurt the Democrats in those midterms, even though it didn't take effect until after the midterms. So it might happen.
I got you. Thank you.
Sure.
Well, not taking effect for quite a while. I guess that's good, but not necessarily politically. Okay, I thought this votorama, this slide is obviously defunct, but I thought it was going to take a few days to go through the votorama. But so just forget this slide.
No, they did it. They did the votorama, I think. That again is a Democratic strategy, is to get Republicans to have to vote for things that are enormously unpopular with the electorate. Put it out there in the campaign.
Yeah.
So it was carried out. They did it. They just did it all night long.
Wow.
Well, the other thing about
short memories
about a votorama also is both sides get to make a political statement, and they can develop commercials from those political statements.
But each political statement is limited to 30 seconds. I don't know if that's what happened, but anyway, I look forward to reading tomorrow's newspaper. Okay. Other medical stuff. We have talked about something Jim and I are very interested in, the U.S. Preventive Service Task Force. And it was being challenged by medical insurers. Do we have to cover everything they recommend? And it went to the Supreme Court. And because it was in the Affordable Care Act, yes, you do have to cover what the USPSTF recommends. And the Supreme Court said, yeah, you do. All this preventive care that we reviewed a couple of weeks ago, those standards has to be maintained and paid for by healthcare insurers. So a bit of good news. Now for some more bad news. Yeah, Bob.
Well, since we're on the subject, which I know very little, which is healthcare, why would an insurer not want its client to have a preventative healthcare program? Surely that would return there would be a pretty good return on investment by discovering early on chronic illnesses, which would then cost the insurer much more money. I must be naive.
Well, the insurer is just looking at the charges that are being made in the next fiscal year. They don't give a damn about the long range. But the Obamacare did and put these standards in. You haven't been covering it, but now you've got to start covering it because it's in the interest of the state to have healthy people who live a long time. Now, it's not necessarily in the interest of the budget of the government to have a healthy population. The best thing for the American taxpayer budget would be for us all to work until we're 65 and then drop dead the next day so that we don't draw out Social Security and so we don't cost Medicare anything. So the interest of who's paying for preventive services is fraught. It's complex, and I'd welcome anybody else that wants to expand on that. Jim, I knew you would. Jim.
You knew I would, huh?
Yes.
Yes.
I was counting them.
Who knew that healthcare could be so complicated? Quote Donald J. Trump. I would just add that it is complicated and that multiple studies have shown that annual physicals on asymptomatic people are a waste of money.
Yeah.
So, it's, but I am very supportive of the USPSTF. Vaccines are getting the hit similarly. And have already been affected. Their recommendations, at least the recommendations for vaccines, and the FDA will have to either support Bobby or not, which there is no head of the FDA right now. So
Oh yeah,
what's going to happen
there
with
is.
the retrenchment of vaccines is uncertain.
Well, there is a head of the FDA. There's not a head of the CDC. I'll get to that's actually on the agenda
Okay,
for
sorry.
today. But
Yeah.
since Bob brings up an interesting question about the interests of the state and the interest of people, the cost of providing services is just one side. What is the benefit? And the sophisticated measure is the cost of year of life saved with preventive interventions. And the most cost effective is immunizations and the prenatal care. Those two win the prize as being the most effective. But the cost of year of life saved has been perfected in Britain. They have an organization called NICE, NICE, and they look at every intervention that is proposed to be included in the National Health Service, and it is entered into their chart. And if there's anything that's more cost effective, saves more years of life per input, that goes first. And your new intervention takes its proper place until they have enough money. And where does that fall? As Jim points out, with the intervention of an annual physical, it's not very cost effective. But the cutoff line is somewhere between $50,000 to $70,000 per year of life saved. And that's roughly where it was for mammograms the last time I saw that. So I think colonoscopy screening, you get more bang for your buck. But I haven't looked at this stuff in 5 years, so there might be some new stuff. But whether preventive screening is useful, you've got to ask to who, and it's the bell tolls for you and me. That's who it's useful for. Government and insurance companies be damned. Yes, Homer.
Well, alluding to your comment that measures that prolong life in costing Social Security, what the government might want is people to work to 65 and die 1 or 2 years later. You pointed it out to me tongue in cheek about in the early 1970s at your house, that the success of smoking cessation, getting people not to smoke, was going to prolong longevity and increase costs to Social Security. So there you are.
There I am, and I think I included the interesting fact that a communist country that controls so much in China, they don't stop people from smoking in China. They're perfectly happy with workers who smoke, because you can argue that nicotine actually improves productivity. Yes, you can, but it doesn't. It plays havoc with longevity. But as long as, and of course, there's morbidity. So you've got that's one other thing you've got to measure. How
That's why some measures refer to productive years of life saved.
Yes. Yes.
Yeah, and tobacco smokers usually die pretty fast and cheap deaths because
half
of them are heart attacks.
Yeah,
and
but
lung cancers.
if they get chronic obstructive pulmonary disease, they're disabled for a really long time.
That's true. But yeah, I don't know what percent of those, Homer, are versus heart attacks and lung cancers.
Yeah.
Yeah. Okay. We go deep in study group. I love it. All right. So
Hey, John, my hand's raised. Can I add something here?
yeah, sure.
So somebody can correct me with the right words, but back to this Kennedy business and vaccines. I heard that the insurance companies were like forming their own committee because to them, if you pay a little bit of money for vaccinating people, in the long run, it's going to make more money for the insurance companies. That's what I heard.
Well, I'm going to get to that.
Oh, okay. Very good.
I may not answer your question precisely, but the very next slide starts to get us at least to what I have today. So here he is with Mehmet Oz, who's in charge of Medicare and Medicaid. He was a talk show fellow, ran for the Senate in Pennsylvania. And they are addressing the health insurers who just met. No doubt the recent assassination of one of their members is top of mind. So they vow, not for the first time, to fix prior authorization. And with Kennedy's encouragement, such a political loser. Last month, and this is getting to the immunization stuff, there's an advisory committee on immunization program, ACIP. And Kennedy fired all 16 members last month. This committee is overseen by the CDC. He reappointed people to the committee that are sympathetic with his oddball views on vaccination and anti-vax people. And so push came to shove on May 17th when they removed the recommendation for vaccines for pregnant women and children. They did that, this new reconstituted committee of Kennedy. He called it common sense, but pediatric and obstetric organizations decried the decision. Here you have protesters outside where the ACIP is meeting.
And that was just for COVID, wasn't it? It wasn't for all vaccines.
Just for COVID, yes.
Okay, yeah.
Thank you. So when Kennedy did this, he said, we're now moving a step closer to realizing President Trump's promise to make America healthy again. And he's got flanking him two docs. Okay, so this is Marty Makary, and he is the head of the FDA. And this is Jay Bhattacharya, and he's the head of NIH, replacing one of my heroes, Francis Collins. I could talk a lot more about him, but let's go ahead. And neither of the NIH or the FDA are at the front line of making recommendations on vaccines. That's CDC and ACIP. And remember, CDC doesn't have a director, nor do we have a Surgeon General, as we've talked about before. So let me just mention, because here are two doctors, and we got a few doctors in our group, interesting backgrounds, both of them. Makary is Egyptian American, born in Liverpool. And he was a pancreatic surgeon, a big cheese at Johns Hopkins. And he's done some constructive stuff, like coming up with the simplest thing, the surgical checklist, which was modeled on airplane pilots, which was a big improvement in reducing medical errors. And in fact, it was so successful in this country that it was developed by the World Health Organization. He's also involved in the Orphan Drug Act for people who have rare diseases for which there is a drug, but no incentive for drug companies to make them. And he totally mainstream. He got his MPH at Harvard with a concentration of health policy. It's not like he's picked from obscurity. He has a mainstream portfolio. So during the COVID pandemic, he supported masking, and he was all in favor of vaccines for adults as long as it wasn't mandated. And he was very much against, therefore, school and university restrictions on the unvaccinated. But still in the mainstream, mostly. The controversy comes when he wrote a paper on medical error and asserted that a third of all deaths in the United States comes from medical error. That was heavily criticized for many different reasons. And one of them, the consequences of that was it felt like it opened the door to alternative medicine who are not operating under the same rules of documented benefits for healthcare. And he wrote the article in May that would limit the FDA's involvement in vaccines to people under the age of 65. So I assume that this article was the one that was underlying the removal of the recommendation for pregnant women and kids. And also, there's this, Kennedy keeps saying that that we need controlled trials, that we need to start fresh with new controlled trials. And he fails to understand that any controlled trial you can't have a pure placebo control. Because if there is a known benefit from existing vaccines, that vaccine has to be the control, not a placebo. And he just doesn't seem to get that it would be totally unethical to withhold vaccines of proven benefit for a study. So anyway, that's a blind spot. Let's turn to the other guy from NIH. He was born in Calcutta, India, to a Bengali Hindu family. So in the medical establishment, it seems like we're dealing with a heavy immigrant population. And he's the one that I said would represent Stanford today. He got a medical degree and a doctorate in economics at Stanford, but he never went further. He never did a residency. He never practiced medicine. Nevertheless, he became a professor of medicine and economics But he was focused on population health and the role of government programs in innovation. So a pretty solid curriculum vitae as well. So he was outside the box on COVID, though. He opposed lockdowns and mask mandates. He wrote something called the Great Barrington Declaration, which was 10 months into COVID, before the vaccine was available, months before, a couple of months before. And he argued that young people and healthy people should return to normal life so that they could achieve, the low risk groups could achieve herd immunity. Now, that's not crazy. Sweden essentially did that, if I'm not mistaken. But certainly the schools needed to reopen sooner than they did. I think everybody agrees now that part of it was correct. But the WHO looked at his recommendation in October before there was a vaccine and said that it was scientifically and ethically problematic. And this is now 4 months after the COVID vaccine in March 2021. He said that lockdowns were the biggest public health mistake we've ever made. Well, some of us remember the early days in Italy, the early days in Queens, when people were dying in the streets. So you can look back and forget the kind of pressure that we were living in. And he got involved politically in Florida with their attempt to prevent the use of masks in schools, even if that's what parents and teachers wanted. He lost that case. And then he went on to pretty far right political organization. And he's become palsy with Peter Thiel, who we talked about a lot. The one guy most responsible for bringing the tech bros over to Trump's side from Obama, and Elon Musk. So they're palsy with him, and maybe that's why he got it. Yeah, Jim.
I was just going to agree with you. I know that's rare, but he's an economist. He's not really a public health guy.
Yes.
So he's after, and you're right. The schools should have opened sooner, but his other stuff is crazy.
Yeah, who knows? Everything's clear looking back. Yeah,
So,
Michael.
I just wonder, not that this is a criteria, but does he have a list of publications, or is he of somebody who's been plucked out and picked because he supports Trump?
Do you think Stanford would allow him to stay, Michael, if he didn't have that?
Well, I don't know. I'm just wondering. I mean,
it's a serious question, and the answer is yes. He's well published.
So I got a question here, and opinion. Why do these guys think this way? Why? What is their motivation?
Anybody? Class? Anybody? Bueller? Class?
I think he was like Sweden. They thought they could, go the middle path and keep the economy going and risk a small risk to certain populations. But Sweden had a higher death rate per capita. So
how much higher was Sweden's? That's a good question.
Well, I think I'd have to go back. I have it somewhere, but it was significant, 20 or 30% higher.
I want
Jim,
to
wasn't it later? It was like a second wave, right? Once they sort of opened up.
Well, that's when the declaration came out, and later in 2020.
Yeah,
Mhm.
yeah, but I'm
Sweden, you're right. Sweden did not relax things until probably 2021.
yeah,
I
I'm
think you're right.
I'm not a doctor. I'm an engineer, but it seems to me you'd sort of want to take the conservative approach, and both of these gentlemen aren't taking a conservative approach, so that's sort of like bewildering to me.
Well, it's economics and it's Stanford. I'm sorry, John. I mean, look at the neuroradiologist that that Trump brought on during all this.
Can I just speak for a
Dr.
minute
Atlas.
in support of school closure? I was part of a network funded by the National Institute of Allergy and Infectious Disease, conducted a study of school-age children, and they had a nasal swab every week and whenever they developed symptoms of a respiratory infection. And if anybody was positive they were submitted every week. They were good samples that held up. And if any child developed COVID, they then swabbed all members of the family frequently for the next 2 weeks. The finding was that many, many children were COVID positive in the absence of symptoms. And yet members of their family also converted to positive. So if you want to protect elderly people living with school-age children, like grandparents, it makes sense to try to cut down the spread to children. It was early on thought this is rare, an infectious disease for which children are not vectors. In fact, children were. So given especially how little we knew about the virus when we had to make decisions about school closures and school reopening, I think there was still a defense to be made. Certainly that could be well defended, keeping schools closed until you could vaccinate the population. So there's my 2 cents.
So it's interesting. What does Italy have in common with the Queens? This is where people were dying in the streets. And what they have in common is multi-generation households.
Uh-huh.
Granny lives up in the attic, and the young kids are coming home from school, and they get a big wet kiss and a lot of hugging, and they all eat together. So that's a factor. Multi-generational households.
Thank you, John. That supports kind of what I was saying.
Yes, it does.
Interesting.
Yeah. Okay, Aiko tells me that I'm very close to running over, which we try not to do. But let me I'll just peek what the next slide is and see, is this a good place? Let me just finish a couple of points. They were wrong when we got to Omicron. The COVID booster for Omicron was important, and Bhattacharya, the NIH fellow, made misleading statements about the Omicron booster and how that was tested for. And now Bhattacharya, the head of NIH, wants to prevent grants from being made to universities that fail to support academic freedom. Oh my God, what's that definition? And he wants to eliminate subcontracting with any foreign researchers. And so yeah, Carol.
So what does that mean, foreign researchers? That means they're in foreign countries?
I think so.
Yes.
Yeah.
But since we're having so so many of our researchers being like leaving for foreign countries since they're not getting funded, that means we won't have any research?
Well, what prompted this was the subcontract with a virology lab in China that has been considered a possible source rather than an animal market for the emergence of the release of COVID.
Mm-hmm.
So that was what prompted this. That's what they meant to do, to cut it off with funding given to a U.S. university lab being subcontracting with a research lab in another country.
So is that continuing now then?
Yep.
So we're not going to have any.
They're now banning it now. You can't do that subcontract.
And one of those was in Wuhan, unfortunately.
Yep. Yes.
Isn't Wuhan like an enormous research facility? So they do a tremendous amount of research that's kind of important.
I think that unfortunately, the research lab isn't that far from the wet market, which confused all kinds of things. So anyway.
Okay, thank you.
Yeah, sure. Let's Cassidy is a doc. And when Kennedy was being quizzed in the Senate, he promised that he wouldn't mess with ACIP committee, and he did. And so the study that was presented to the jerry-rig committee showed that pregnancy and infancy and children were perfectly good targets for receiving the vaccines, and there's no increased risk, certainly to mRNA, which Kennedy fulminates about. And it was based on a study including 68,000 pregnant women called the most extensive safety monitoring program in U.S. history. So Cassidy has got to go on the offensive. And of the 65 possible adverse effects, there was only one condition, myocarditis, where there was found to be a statistical risk. And that's a short-term problem when it happens. And 90% fully recover within a year. And when the vaccine was reformulated, the incidence fell to 1 case per million, which is half the rate that's found in the background general population. Nevertheless, the FDA just announced a new warning label. And all this is going to increase questions and undermine the acceptance of vaccines. This is where we'll stop. Where you are politically determines how safe you think vaccines are. There you go. All right. Any other questions? It's been an excellent discussion.
Well, can I just add something about that subcontracting? From my experience some years ago when I was doing clinical trials, a lot of the pharmaceutical companies subcontract out to researchers in other countries because in the United States, it's difficult to get enough subjects to participate. So in many countries where they have not the best medical system, people will sign up for all these various medical trials. And if what they're doing is cutting off that subcontracting, a lot of medical trials, pharmaceutical trials here in the United States will probably not be able to enroll enough people because in the United States, people say, I don't want to be a guinea pig.
I think that was just NIH or federally funded research, pharmaceutically funded research can still subcontract out.
Well, I don't know, but it remains to be seen that if once you start mucking around with federally funded, the pharmaceutical, because all these drugs then have to go back to the FDA to get approval based on, clinical trials done in other countries as well as in the United States. So there may be problems. I don't know. I'm just wondering if it'll impact clinical trials on.
Well, you're certainly right that Australia is a very popular place because it actually helps underwrite the cost of clinical trials.
Well, yeah. I mean, when we would do these, we'd have these meetings about how much recruitment was going on. Oftentimes you'd see a lot of recruitment in other countries. In the United States, it was like begging people to partake in clinical trials, and people just refused to do it. Here, the attitude is that usually when they get into things like end-stage cancer and so on, and they're really desperate, then they'll enroll in clinical trials. But clinical trials, let's say in cancer, in early stage, people will be very reluctant to go along with it.
And then when you do research like that, don't companies contract with a lot of different entities? And if they're partially federally funded, will it become like the universities? If you have any federal funding, you can't do,
Yeah, I mean, a lot of the universities do clinical trials on behalf of pharmaceutical companies, and they also get federal funding. Yeah. I mean, Stanford, let's say, or UCSF is doing a bunch of clinical trials that have pharmaceutical behind them that they're working with, but they're also getting, let's say, federal grants for clinical trials that are NIH sponsored. So there's some industry and some governmental clinical trials. They're all sort of mixed together.
So stopping that eliminating the subcontractors would potentially eliminate those research projects because it's sort of true.
I mean, I can just see this having an impact on clinical trials and pharmaceuticals because the main thing is what I think has been called, Elizabeth Warren said, red light, green light, on again, off again. So a lot of these pharmaceutical companies may not want to deal with the United States. And a lot of pharmaceutical research, by the way, comes from other countries. It's not just pharmaceutical companies here in the US. Pharmaceutical companies that are overseas will probably not want to try to enroll here in the United States because there's so much chaos.
Yippee.
Hey, John, thanks a lot for today's session. Thanks a lot for everybody else contributing to the discussion today. It was really super duper.
Yeah, it was good.
It was particularly
Exceptionally
good. Everybody had their coffee this morning.
Yeah. Well,
Thank you, John.
Even for us sewer pipe mechanics.
Thank you.
Goodbye.
Bye-bye.